How are you doing, guys? I told you that I will explain to you the bushral drainage, but I figured out that to understand bushral drainage, you need some understanding of the lung anatomy, especially the lobes and segments. So what I am going to do, I will do like several videos. This will be the first one. I will try to keep it as short as I can. So first I will introduce, or explain the loops and segments of the lung. Then for each video, I will explain bushral drainage from a different textbook. In this way, you will have like more understanding of the bushral drainage, and hopefully it will stick to your mind easily. For the bushral drainage, you will see questions on the university exam, and at the same time you will see questions on your license exam. Okay, so let's go ahead and look at this. Okay, so this text says, what are the lobes, fissures, and segments of the lung? Basically, what we will be explaining this figure now. Okay, so the right lung consists of three lobes, as you know, including the right upper lobe, right middle lobe, and right lower lobe. Two fissures separate these three lobes from one another. The upper and middle lobes of the right lung are separated from the lower lobe by the oblique or the major fissure. Can we look at this picture together? Okay, so this is the right lung, this is the left lung. For the right lung, we have three lobes: upper lobe, middle lobe, and lower lobe. Okay, and we have two fissures. We have horizontal fissure and we have oblique fissure. Okay, so the horizontal fissure is separating what lobes? Separating the upper lobe from the middle and lower lobe. Okay, let's go back to the text again. And starting on the medial surface of the right lung, at the upper posterior aspect of the hilus, the oblique fissure runs upward and backward to the posterior border at about the level of the fourth thoracic vertebra. It then descends antero-inferiorly across the anterior costal surface to intersect the lower border of the lung, approximately 5 inches from the median plane, and then passes postero-superiorly to rejoin the hilus just behind the beneath and beneath the upper pulmonary vein. You don't have to know all of these details. We just need to know that in the right lung we have three lobes, upper, middle, lower, and they are separated by horizontal fissure and oblique fissure. Let's go next. The right middle lobe is separated from the right upper lobe by the horizontal minor fissure that joins the oblique fissure at mid-axillary line at about the level of the fourth rib and runs horizontally across the costal surface of the lung to about the level of the fourth costal cartilage. On the medial surface, it passes backward to join the hilus near the upper right pulmonary vein. Okay, let's go next. Each lobe of the right lung is further subdivided into segments. So we have each lobe is subdivided into segments, and we need to understand the orientation of these segments. Why? Because when we will be talking about bushral drainage, as you see, what is the point that we are trying to move the patient in a way that this segment is drained using gravity, okay, into segments. The right upper lobe has three segments, including apical, posterior, and anterior segments. These are good and we need to know. Okay, so after we divide the right lung into three lobes, now we divide each lobe into segments. For the right upper lobe, we have three segments. Okay, we have three segments. Okay, apical, anterior, okay, and the other one may and posterior, okay. So apical segment, posterior segment, which and anterior segment. This is the upper lobe of the right lung. Okay, let's go back. So where we are here, the right upper lobe has three segments, including apical, posterior, and the anterior segments. This lobe extends to the level of the fourth rib anteriorly and is adjacent to ribs 3 to 5 posteriorly. So these are the anatomical landmarks. Anteriorly, okay, extends to the fourth rib, and posteriorly, to the adjacent to the ribs 3 to 5 posteriorly, okay. The right middle lobe is subdivided into lateral and medial lobes. This lobe, okay, is the smallest of the three lobes. Its inferior border is adjacent to the fifth rib laterally and the sixth ribs medially. Okay, so let's look at the middle lobe. So the middle lobe is the smallest one, okay, of the lobes, okay. And what else we need to know? Nothing right now. Let's go back again. And the lowermost lobe, or the right lower lobe, consists of four segments: anterior basal, superior basal, lateral basal, and posterior basal. Okay, so again, the right upper middle lobe. Why I'm repeating stuff? Just to stick to your mind. Okay, so we said that we have, for the right upper lobe, we have the apical, anterior, and posterior. Okay, the middle lobe is the smallest and is divided into lateral and medial lobes. Have we seen that? Maybe I forget to show you. Lateral and medial, okay. But the lower lobe of the right lung is divided into four segments, okay. Anterior basal, lateral basal, posterior basal, okay, posterior basal segment. So we have here, anterior basal, superior basal, lateral basal, and posterior basal. Okay. So in this way, for the right lobe of the lung, the upper lobe is divided into three segments. The middle lobe is the smallest and divided into two lobes, medial and lateral, and the inferior, or the lateral, or the lower lobe is divided into four segments: anterior basal, superior basal, lateral basal, and posterior basal. So 3, 2, 4, 3, 2, 4. The superior border of the right lower lobe is at the level of the thick thoracic vertebrae and extends inferiorly down to the diaphragm. Okay, and we know that the diaphragm is separating the thoracic cavity from the abdominal cavity. During maximal inspiration, the inferior border of the right lower lobe may extend to the second lumbar vertebra and superimpose over the superior aspects of the kidney. Okay. Now let's go to the left lung. The left lung is relatively smaller than the right lung. Oh, really? I didn't know that before. And has only two lobes, including the left upper lobe and the left lower lobe. So two lobes only on the left lung. Let's go and see them. So we have left upper lobe and left lower lobes. There is no middle lobe. Why there is no middle lobe? Because here the heart is situated, okay, at the lingula. The heart is situated. What else? The left lung is divided into upper and lower lobes by the oblique fissure, which is somewhat more vertically oriented than that of the right lung. There is no horizontal fissure. Okay, so this is good to know. So let's do some comparison. Right lung is divided into upper, middle, and lower lobe. Left lung is divided into upper lobe and lower lobe. Okay, on the right lung we have two fissures, horizontal fissure and oblique fissure. On the left lung we have only the oblique fissure. Okay, the portion of the left lung that corresponds to the right lung is termed the lingular segment, okay, and is a part of the left upper lobe. Posteriorly, the inferior border of the left upper lobe is at the level of the sixth vertebra, and the left lower lobe is at the level of the 11th vertebra. I'm sorry. Okay. And also it is divided into different segments, as we will see. So this table is nice. Okay, it gives us a summary. So for the upper lobe we have the anterior segment, and this anterior segment is right and left. Okay, I don't think we are in need to know more details about the borders, but we have anterior segments which is right and left. Okay, so right and left here, and these are parts of the upper lobe. Okay, and these are anterior segments, right or left. Apical segments, right, or apical aspect, apico-posterior segment on the left. Okay, and then we have posterior segment on the right, or posterior aspect, and the apico-posterior segment on the left. Okay, so and this is all the upper lobe. This is all the upper lobe. For the middle lobe, we know this is only on the right, and what is corresponding on the left is the lingula, which is the place where the heart is situated. Okay, so on the right we have apical, anterior, and posterior, and here we have anterior, apico posterior, apico superior. I'm sorry. Okay, and what else? And we have here apico posterior segments, apico posterior and the apico posterior segments on the left also. Okay, and this corresponds also 3 segments. For the lower lobe, okay, we said here we have the superior or basal segment on the right and on the left, and the posterior or basal segment on the right and left, and the lateral or basal segment on right and left. Also the anterior or basal segment on the right, or anterior aspect, anteromedial basal segment, okay, on the left. So why we are, why we bother to know these lobes and segments? An understanding of the various lobes and segments and their anatomic orientation is essential for appropriate positioning and removal of secretions from the various aspects of lung during bronchopulmonary hygiene procedures. Again, this is a nice view over here. This is the anterior view of the lung, and this is the lateral view of the lung. Okay, apical, anterior, and this is the upper lobes of the lung. And we see that we have here horizontal fissure and oblique fissure. Here we have only the horizontal, I'm sorry, the oblique fissure. Okay, and these are the different lobes, different segments of of the lobes of the lung. And the next video will be starting talking about the different position for postural drainage. Okay, hopefully this video give you like an overview of the different, maybe different segments of the lung and different lobes as well. Okay, see you in the next one. Thank you.